This is the make or break moment in your therapy, and it arrives in that second session, in the second appointment. And the reason this is such a critical time for your patients is because this is the moment where they are deciding if it's worth investing their money. Most people can get their clients from session 1 to session 2, because in session 1, you have to perform an assessment, you have to perform the notion that you know what you're talking about. It's easy enough to do, but the bridge is the intervention you're doing actually changing anything? That's the question that needs to be answered. The mistake I think people make is, first and foremost, booking patients too far in advance, not giving a small time frame between those sessions, because if that goes out for a week or more, patient symptoms change. And if the symptoms change, you're already flustered. You're already chasing pain, chasing symptoms, shuffling deck chairs, going, oh, I better treat that thing as well. It's too much to try and do in the second visit. You've only seen this patient once before. You've got to get your head around what's going on with them. It's hard to execute here because in the first session you can talk the talk, but by number 2, you've got to walk the walk. And the private paying patients of the world can smell bullshit a mile away. People don't want to put down their hard-earned if they don't feel something substantial is happening in these sessions. And it all gets revealed by this second session. What your patients really want, obviously they want to know you've got the diagnosis and you've got a plan for them, but they want to feel their therapist is confident, they're clear on what's going on, and there is a calmness that resonates with them that makes them feel this person has got me. I need to stop stressing about this injury and follow what they're telling me. The simple things to do are the most effective. This is master's level stuff that anybody can do. It's one clear asterisk to make sure we know this is the problem we're going to be working on. It's one dominant treatment modality, not doing a bit of this and a bit of that and a bit of this and just kind of crossing your fingers and hoping. Do one very specific treatment so you can tell, is that changing things for you? And if that's working, continue to do it. If it's not, appointment number 2 is the moment you can pivot. Nobody wants 6 exercises to take home and do. People are time poor. You've got to be more specific than that. The majority of people can only manage 1, maximum 2 things to execute well. 1 is perfect because it just strips everything back to core ideas. We are solving one particular problem today, and this is the thing we're going to be doing for it. The thing people have to recognize is appointment number 2 is a bridge. It's the bridge between the assessment and the diagnostics and the later treatment appointments. It's the time we demonstrate why it's worth investing your money in this problem, and it is absolutely critical to patient care. So get your second appointment right. Make sure your patient is really on board, you've got your diagnosis correct, and you're doing something that changes the patient, that makes them go, right, I can see the path forward from here, and I'm prepared to pay money and commit myself to going deeper into this relationship. That's it. That is the simplest framework you can apply across multiple domains of problems to get your patients moving forward and keep them engaged. If you've liked these videos, like and subscribe. Check out the link in the comments below, and I'll see you in the next video. Cheers.